I'm Sally Harrison, and I'm in my fourth and final year of the MD-MPH program. As a future emergency medicine physician, I will have the opportunity to address individual emergencies as well as public health emergencies like HIV. For my internship, I spent a month in the Huntsville Hospital Emergency Department assessing provider awareness of PrEP, or pre-exposure prophylaxis. PrEP, known by the brand name Truvada, is a once-daily pill that is 99% effective at preventing the sexual transmission of HIV to HIV-negative individuals. While the incidence of HIV is declining in the United States, it is not declining as quickly as we would like, and the southeastern U.S. remains disproportionately affected by HIV. One barrier to preventing the spread of HIV is insufficient use of PrEP among high-risk individuals, often because medical providers are unfamiliar with PrEP. Emergency department providers are unique in that they see a variety of patients at high risk of HIV infection who could benefit from PrEP, such as those who have unprotected sex or have an HIV-positive sexual partner. In fact, emergency departments in Florida and other states have established programs that routinely test patients for HIV and prescribe PrEP to appropriate individuals. The first step to establishing similar programs in Alabama is for emergency department providers to be aware of PrEP and its use as HIV prophylaxis in HIV-negative individuals. In early January, I met with Dr. Daniel Newberger, an emergency department provider at Huntsville Hospital, to ask for help with assessing provider awareness of PrEP in the emergency department. He supported the project by serving as my mentor and providing logistical advice. For example, he advised me to keep my interactions with providers short because the nature of the emergency department is that providers have very little free time. He also arranged for me to attend an emergency department physician meeting and several nurse huddles to maximize the number of providers I could assess at one time. The PrEP assignment I designed took about 3 minutes to complete and was a 4-page document I administered to willing emergency department providers. The first page was a description of the assessment and emphasized that the survey was anonymous. The second page was the pre-intervention survey. It consisted of 8 questions, including demographic information such as role in the emergency department, gender, and age. It also assessed whether providers were aware of PrEP for HIV, whether they are aware that Truvada is used for PrEP, and whether they are aware of efficacy data for Truvada as PrEP. If they were aware of efficacy data, they were also asked to correctly identify that Truvada is 90 to 99% effective at preventing sexual transmission of HIV. Lastly, the survey assessed whether providers were aware of high-risk groups for whom PrEP is beneficial, as well as their knowledge of local organization or resources that offer PrEP. The third page of the assessment was an infographic titled The W's of PrEP. This served as my public health intervention and briefly addressed what PrEP is, why it is effective, who benefits from PrEP, and where to get PrEP. The fourth page of the assessment was the post-intervention survey. It was identical to the pre-intervention survey, except it did not ask providers to re-answer their role, gender, and age. From this internship project, I learned that about 1 in 4 Huntsville Hospital emergency department providers were unfamiliar with PrEP's use as HIV prophylaxis, and half were unaware that Truvada is used for PrEP. However, I also learned that an intervention as simple as having emergency department providers read an infographic can improve awareness of disease-preventing medication like PrEP. After reading the infographic, 96% of providers answered that they had heard of PrEP for HIV, and 94% answered that they knew Truvada is used for PrEP. One of the biggest challenges I faced implementing this project was just unlucky timing. The same month I was asking emergency department providers to take time to participate in my project, the hospital had implemented a new electronic medical system, so providers had even less free time than usual. However, I was still able to enroll 68 providers into my study. This internship allowed me to take what I had learned in my public health classes and combine it with my interests in emergency medicine, HIV prevention, and serving vulnerable populations. Instead of designing a hypothetical study for a class, I had to design a study, adapt when I met obstacles, effectively communicate across occupations, and convince busy individuals to participate in my study. Going forward in my career, not only was this internship proof that I can implement a public health intervention, but it makes me wonder how we could implement an even bigger intervention across emergency departments in Alabama and across the country.